Live from Seattle with Tim Gatos continues on 820 AM. The Word.
We welcome you back to the program. Thanks for being with us today. We're so glad you're here. Glad you're tuning in, and we're so glad right now to welcome Dr. Farah with us. She's a medical expert and cardiologist based in the great country of Texas. Hey, tragic incident this past Monday Night Football. Buffalo safety Damar Hamlin had his heartbeat restored on the field after suffering cardiac arrest during the team's game Monday night against the Bengals. He's currently in critical condition at a Cincinnati hospital. Dr. Farah is joining us to help us make sense of this. Doctor, welcome to Live from Seattle.
Thank you for having me.
Well, I guess just ask you, were you watching the game when it happened, and what were your thoughts when it was currently going on?
I was not watching the game when it happened, but I did see the video afterwards. A couple of thoughts went through my head. He did get a hit in his chest, and one of the thoughts was something called commotio cordis. It can certainly be the cause behind his collapse. It's when we get a sudden blow to the chest. If it's strong enough, it can cause our heart to stop, and it can certainly lead to cardiac arrest and collapse if that heart doesn't restart back on its own. So that could have been one of the reasons, but there are certain other things. There's something called hypertrophic cardiomyopathy. It's a genetic condition that a lot of people are born with. People who have it, they have an enlarged heart because their heart muscles are increased, and they can go into cardiac arrest because of arrhythmia when they're involved in strenuous activity like sports. And in fact, the way the video played out, the way this event took place, that's a very classic presentation of this condition. Usually, a lot of times that is when athletes are diagnosed with it. They'll just have a sudden cardiac arrest and collapse during a sport event. So that could have been one of the causes. Also, going back to that blow to his chest, the hit, there's something else that could have led to this that's called cardiac tamponade. Tamponade is a phenomenon where if we get trauma to our chest, like a hit to the chest, it can cause blood to our heart sits inside a sac called a pericardium. In a normal heart, there's not enough space. There shouldn't be any space between that sac and the heart. But when we get trauma to the chest, we can get blood in that space. And if the volume of blood is large enough, then it can cause cardiovascular collapse and cardiac arrest as a result. So that could have been it too. So those are some of the thoughts that went through my head.
Mm. And so since that time, when those thoughts were going through your mind, I mean, I guess update us with if you know where things are at, and if there's been any updates to your thinking since then.
Yeah, one of the major things that went through my mind was not just his survival, but long-term prognosis. He's still in critical condition, as we know, and it's like, how well he's going to come out of it in the immediate setting, and also long-term prognosis, like is he going to sustain any long-term complication from it, such as neurological deficits. One of the things we worry about when we have a cardiac arrest is exactly that, neurological deficit, because when we get abrupt blood flow supply that gets cut off to our brain is very sensitive to that because oxygen doesn't get to the brain, and then we can sustain damage to our brain, and it can cause us to have long-term issues like, so that's something that's a major concern, because his resuscitation time was quite long. It was more than 10 minutes, and so that is something we need to look out for.
Yeah. Now, this was, they were doing CPR on him for about 9 minutes. They tried to do a defib. Is that right? And that worked for a time. Talk us through what the protocol is in a situation like this.
Yes. So usually when we have a cardiac arrest, it means we don't have a pulse. And we also are not able to breathe on our own. That means the heart is no longer beating. The heart has completely stopped. And CPR, the purpose of that is to restart the circulation because the heart is no longer pumping on its own. And when we're compressing on the chest, we are essentially beating the heart for the patient so that circulation continues so that we don't get damage like neurological impairment and also bring the patient back, essentially, so to speak. Defibrillator is very much a part of that resuscitation process. Defibrillating a patient essentially means we are shocking the heart to restart it again. And the scenario when we do that is if there's arrhythmia. So when when a patient has a cardiac arrest and if there's a defibrillator available, which is an AED, an automated defibrillator, we hook them up to that and the machine detects if there's any kind of arrhythmia going on within the heart. And the arrhythmia we're talking about a very specific type of arrhythmia. It's usually ventricular arrhythmia. There are two different types. One is called ventricular tachycardia and the other is called ventricular fibrillation. I don't know which one he had, but they're both essentially similar. They both require shock. And, he did receive defibrillation, so that tells me that there was something going on with his heart. His heart was beating not normally. And the fact that he received the shock, that's a very good thing for people who go into these types of ventricular arrhythmia. The shock is very important in terms of resuscitating them and bringing them back. That's probably what helped bring him back and get a pulse back on him.
Now, of course, there's a lot of conversation out there, a lot of folks talking about this. And I think probably talking about this perhaps more than perhaps normal is that there's been other, just interesting scenarios that have been taking place over the last year or so around, young athletes, just, young healthy athletes just kind of keep dying and having these cardiac incidences. Is this anything that you're tracking or watching or seeing?
I am, yes. I'm glad you brought it up. This is something actually, especially the condition I mentioned, hypertrophic cardiomyopathy, that is a well-known condition. And as I said, classic presentation when we see young athletes will just drop on the field while playing a sport. So I think it's very important to raise awareness and for people to go through a screening process. And it's not just for professional athletes, to be honest with you. We see these tragic events even in high school athletes and even middle school athletes. So I really think anyone who's going into aggressive sports, like contact sports like baseball or football, basketball, they ought to go through screening just to make sure that they don't have any pre-existing conditions that can predispose them to these types of catastrophic events. It's a very simple screening, just an EKG and an echocardiogram, both in office. I think it's well worth it. Even if we can save one life with that, it's worth it.
Yeah. And of course, the question that some are asking is the vaccine, could that impact this? Obviously, there's a lot of cases of myocarditis with the vaccine for young males and, that potentially impacting their heart. Is this a possibility?
It is, although a rare possibility. I will say that, throughout the pandemic, I'm sure you've seen it in the news, we've had several tragic events where athletes had a cardiac arrest, and some of them actually died. And it wasn't so much to do with the vaccine, it was more to do with the virus itself, COVID-19. We've had several athletes who had COVID-19, and they were actually not very sick when they had COVID. Some of them were actually asymptomatic, but nonetheless, they sustained some damage to their heart because we know that COVID is capable of causing damage to the heart. And so they were not symptomatic while they were usually doing their usual activity, but when they went back to the field to play sports, that was a lot of strenuous activity, and what they had actually was myocarditis due to the virus itself. And when they went back to the field, they had cardiac arrest because what myocarditis does is it increases the risk of arrhythmia, the same arrhythmia that I was discussing earlier, ventricular arrhythmia. And it increases that risk with activity for those who have myocarditis. So when these athletes are going back to the field and, playing sports, they suddenly have that arrhythmia and they have cardiac arrest. So that's more notable with the virus itself than the vaccine. Have we seen it with the vaccine? Yes, we have. So it's hard to say, whether the vaccine is playing any role or not, but judging by the statistics we have so far, very rare.
Yeah. I mean, that would be probably something that people would probably want to investigate or know if the vaccine is impacting this in any way. Dr. Peter McCullough, who's you've probably heard of him, cardiologist, who believes that the leading concern here is vaccine-induced myocarditis, with why we're seeing so many young athletes just collapsing on the field.
Yes, we did have some concerns of that in the middle of the pandemic last year, in fact, where we saw more males being affected more with that than females. It's an interesting thing. Although CDC has been tracking it, and the numbers so far are extremely rare. And so that's why I don't want people to think that they don't need to take the vaccine, because the vaccine by majority is still life-saving. So that's why I don't want to create panic in people without having enough evidence for it. So I really think we need to be careful with that. And I absolutely agree that we need more studies done. We do need to gather more data to see how the vaccine is impacting everybody, especially the young male athletes.
I mean, I guess it just poses the question that I think is a fair question about if a young athlete, someone in their 20s, 30s, who, based on, the COVID statistics, they're really not, in danger, right? I mean, statistics show that they're just simply really not, the danger for them of COVID is in your language, is very rare. And without knowing what the vaccine can do with the potential of myocarditis, isn't it, why would someone in their 20s who's healthy get the vaccine if they're not in danger of getting really sick from it?
Well, again, throughout the pandemic, we have actually seen even young folks in their 20s get very, very ill, requiring ventilation, and we actually lost many young folks to COVID. And so, we can't necessarily say that it doesn't impact young people, COVID-19, because it does, actually. And you're right, for those who have pre-existing conditions, who are older in age, they tend to have more of an impact, and young people less so. But that's not to say that they're 100% safe just because of their age. So I still think that it's important for young people to get vaccinated. And as I said, CDC has been tracking these numbers, and of the statistics we have so far, yes, we've seen myocarditis happening from vaccination itself, but we've seen more myocarditis. The rate of myocarditis is higher in the people who actually got the virus itself. So the virus is still showing worse prognosis than the vaccine.
We're talking to Dr. Farah, who's a medical expert and cardiologist. We're talking about the just incredibly sad instance of Buffalo safety Damar Hamlin. We'll take a quick break. We'll be right back with Dr. Farah right after this on Live from Seattle.
You found the right spot for Live from Seattle with Tim Gatos, 8:20 a.m. The Word. We'll be right back. Live from Seattle with Tim Gatos continues on 8:20 a.m. The Word.
Welcome back to the program. Thank you for being with us today. We're so glad you're here. Thank you so much to Dr. Farah for being with us, a medical expert and cardiologist. We're talking about what happened to Damar Hamlin, the Buffalo Bills safety who Monday Night Football had a cardiac incident, and just a lot of questions folks are having about that. Even a lot of NFL players, I don't know if you've seen this, Doctor, are concerned right now, and wondering, if they needed to or should have, gotten the vaccine. They're worried. People are kind of worried because they're seeing, healthy athletes, I mean, I don't remember a healthy athlete since Hank Gathers. You remember Hank Gathers? That he played for Loyola Marymount. Do you know that basketball player, Doctor?
I do not.
So a lot of people are kind of referencing him, but that was about 34 years ago when he had a cardiac incident. And a lot of people remember that. That's how rare they are, right? To have an athlete just kind of collapse and die. So the last time anyone kind of remembers, healthy athletes just kind of collapsing and having an incident like this is, about 34 years ago. But now they're happening more often, and people are kind of chronicling this. I don't know if you're familiar with Dr. Aseem Malhotra at all.
No, not really.
Okay, he's a cardiologist, and he recently he's a fairly well-known cardiologist here in the country, and was a very adamant supporter of the mRNA vaccine when they came out, and he recently has kind of done a 180, and he said he felt that he initially couldn't talk as bluntly, I guess, as because he felt there was pressure in the medical community to not say too much of what they think, because there was kind of a way to talk about this. But he said recently he's had to really just kind of be more public about it because of specifically around the mRNA vaccine, and that his belief is that with all of the cardiac incidents we're seeing are directly due the strokes, the heart attacks, the arrhythmia, the heart failure, he believes are due to the mRNA product.
I would like to point out that it's such a new thing, both the virus itself as well as the vaccine. We simply don't have a whole lot of data to say that definitively. So I do want to caution making any bold statements like that. And I come from a completely unbiased opinion. This is my true professional opinion, that we've seen so much over the course of the last 3 years, so much of just tragedy as a result of this virus, COVID-19. And in many ways, the reason we are doing as well as we're doing now, as opposed to what we saw, in New York, for example, at the beginning of the pandemic, and elsewhere here in Texas, in Seattle, we saw it all across the world. How many lives this virus has claimed? It's millions. And so I do think the vaccine has played a very positive role in terms of minimizing that number. We are at a much better place now than we were before, largely due to the vaccine. So is it a perfect system? Is it a perfect vaccine? Probably not. Just as any other medical treatment and preventative measures like other vaccines, there are risks involved. It's not a 100% risk-free thing for anyone. So I really do think that we need to gather a lot more data so that we know exactly how the vaccine is affecting everybody, including the young athletes. And same thing for the virus. We also have to know and remember what this virus is capable of. This virus is unlike anything we've ever seen. I'll give you an example. We need data not just from this athlete standpoint, but other things like lymphoma. We have had certain, not a whole lot of data, but we are seeing that patients who have lymphoma that were dormant before, with the virus, it's activated. The patients are now in acute, they're acutely ill with their lymphoma. So just like that, there are many, many, many aspects to both the virus and the vaccine that we don't know yet. So I would refrain from saying any statements like the vaccine is what's causing all of this, because I frankly don't think that's the case.
Yeah, I mean, you mentioned, being able to get more data, right, and really see what's going on. And I guess that, again, just kind of brings up the question, should we not have gotten more data about this early, especially the vaccine certainly has helped people who are probably elderly, older, who have chronic health conditions, comorbidities. But to mandate, young people, to mandate college students who are healthy to get the jab if we don't have the data necessary to know how this could impact them, specifically the mRNA. Do you think that was a good thing?
It is a very difficult question to answer just because I've seen both sides of it. Being in the front line, I've seen the tragedy of how many young people that actually claim the virus. I've seen many young people in the hospital, in the ICU, on the ventilator. So coming from that, just like, when we first started 3 years ago and seeing it all the way through and to where we are, it really is a difficult question to answer because had they not done that, would we have lost a lot more lives? We've seen what it was capable of doing. And at the same time, I understand what the other side of the debate is, that if these people are healthy, why are we mandating it? Is the vaccine causing more problem? We simply don't know because I've seen actually people with, in their 20s with absolutely no medical conditions whatsoever, playing sports, die with the vaccine. So, I understand both sides. I understand both sides of the concern. I understand the side where, the people who are in authority made the call that we got to make these changes so that we save majority. I think their concern was the majority. How do we slow this thing down? How do we save and protect majority of the public? But now we're at a place where we need to perhaps reconsider, reassess, and gather more data, and then make those future decisions. Because in the past, when we made those decisions, we really didn't have any data. A lot of it was panic-based. A lot of it was for public health. So, I do think that we need to sit down, the experts, gather more data, and just come with a better solution.
And who are the experts, in your opinion?
It's, a lot of it is these decisions are made at a government level, of course. And
are they the experts, though?
They're not at all. But they're being guided by experts, like CDC, for example. They have doctors in place, researchers in place. A lot of them are watching, with the little data that we have so far. So those are who are guiding everybody, including the medical professionals. So we're all kind of at.
But if we look at, what's your opinion of how the CDC did? Because, before the pandemic, if you would have asked me, what's your trust level in the CDC, I would say 100%. I have not one thing to say negative about the CDC, right? My trust level was 100%. Today, it's probably about 30% because of just how it happened. I didn't feel like they led in this. They were just kind of the tail wagging the dog, and there really was not a lot of leadership, and there was just a lot of shutdown of dissenting opinion. We had a doctor here on the program recently who talked about how he felt he had to follow even though he didn't really believe certain things, he had to follow it, or he would lose, maybe his practice or his license. You're seeing that now in California, where if you don't, certain people get to define what misinformation is, and if they don't follow that particular, whatever that person says is misinformation, well, then they could get in a lot of trouble and get their license taken away. That doesn't seem like that's the way the health and medical community should operate, should it?
No, I can see your point. There are certainly a lot of frustration, even from the medical community, because, as you know, throughout the pandemic, we did receive a lot of mixed messages at certain times, especially towards the beginning of the pandemic. For example, whether we should wear a mask or not. and they said masks were not necessary at the beginning, including the World Health Organization. And that actually directly jeopardized a lot of healthcare professionals. A lot of doctors and nurses lost their lives because they were exposed to the virus. So I agree to some degree that there could have been more unified messages for the public and the healthcare professionals. But at the same time, it was a panic situation. It was something we were not at all prepared for. And that is a problem in and itself. Why were we not prepared for something like this? So I hope that this teaches us all a lesson.
But do you want to follow experts who panic? Like in your life, are you going to follow anyone who panics like that? I mean, I'm not going to follow anyone who panics like that. You have to follow someone who's principled, who's reasonable, who's logical, who's sensible, right? Not someone who panics.
Oh, you're absolutely right. We don't want to panic, and that's the lesson here is, when do we panic? When we're unaware and unprepared. And in many, many ways, we were unprepared for a pandemic. And, when we nationwide ran out of hospital beds, we ran out of basic supplies like protective equipment for our healthcare professionals, even when we ran out of ventilators, that was all an eye-opening experience for all of us as we experienced it and watched it. So it was really a wake-up call for all of us, and a lot of lessons to be learned. And I hope that we do learn our lessons and better equip ourselves moving forward, and that we learn to work together. I think that's a unified response and support from, at all aspects, at all levels, is very important, in my opinion. I think that's the lesson here.
We're talking to Dr. Farah, who's a medical expert and cardiologist. We're going to take a quick break. We'll be right back. We got a few more minutes with Dr. Farah right after this on Live from Seattle.
You found the right spot for Live from Seattle with Tim Gatos, 820 AM, The Word. We'll be right back. Live from Seattle with Tim Gatos continues on 820 AM, The Word.
We welcome you back to the program. Thanks for being with us today. It is a beautiful day here in the Pacific Northwest. We're so glad to have Dr. Farah with us, medical expert and cardiologist. Started off talking about Buffalo safety Damar Hamlin, and who had the just tragic cardiac incident in the game on Monday. And it sounds like he's doing better and better as the days go on. I guess he wasn't breathing for many, many minutes, and they never declared him, brain dead or anything like that. I mean, it sounds like he's making a recovery. Is that right, Doctor?
That is correct, yes. From the updates we're getting, they are considering, trying to get him off the ventilator and things like that. So I'm hoping that he does have a complete recovery and that he doesn't have any long-term complications like neurological damage.
Yeah. And going back, I know we just got a couple more minutes, but some folks there's been a number of studies and statistics out there. And again, statistics are like, data is interesting, right, doctor? Because a lot of times you can make data do a lot of things that you want it to do. It seems like there's always someone's got stats and data for a lot of things. One of the things that there's some data going around right now is the number of athletes collapsing and dying. And in fact, there was one in Europe recently. Some folks came out and talked about the number of European athletes who have collapsed, and many who have died, and that there is over 1,500 over the past year and a half, compared to 29 in average per year in years past. That if true, that is, wouldn't you think that's pretty alarming?
Oh, it certainly is. Yes. That many young athletes suffer like that. It's quite alarming.
And I mean, what are your thoughts on what should be done when it comes to really investigating and knowing what is what, right? I mean, I think that's what everyone really wants in this world, right? If there's one thing we want is truth. I mean, everybody wants truth. They don't, I mean, I don't care what it is. I just want what the truth is, right? Everybody wants to, is the vaccine, should my children get the vaccine, right? Truth. I don't care if is it helpful for them? Is that going to help them, or is it going to hurt them, right? People just want truth. And
absolutely.
So how do we go about to get to the truth of the matter in this?
I completely agree with you. We are all seeking the truth. And, I will say that I know there's been a lot of political, influence over many things over the course of the pandemic, which shouldn't have been. I do want to say that, that there was a large study done at the completely medical community doing the study. It was a veteran affairs study. They looked at people with the virus, not the vaccine, but they simply looked at the virus, what COVID-19 is doing for the heart. It was specifically to the heart that was looked at. And this study actually shed a lot of light in terms of how damaging the virus is. It looked at different conditions of the heart, and there were like 20 different conditions, and across all of them, it showed that there was a sharp rise in heart conditions, all 20 conditions related to COVID-19. So we now have evidence. We know for a fact that COVID-19, the virus itself, is capable of causing heart disease, is capable of causing weakening of the heart muscle, and those all have poor prognosis long term. And so that evidence we have. What I would like to say, is that it's imperative, as you said, that we stick to the truth and scientific, real evidence-based practice, whether it comes to deciding to take the vaccine or not. So that being said, I really truly want to believe, and I hope that there is integrity, but I do believe that in the scientific community, at least, we need to keep it completely apolitical for very reason that we're discussing right now, so that we have the truth, we have the real data, and we know what's good and what's not. We know for a fact that the virus itself is capable of affecting many, many people. And I hope that we will put in the resources into doing more research and keeping it scientific and figuring out whether the vaccine is helping or hurting, so that we have an answer for everybody and those who are worried about whether to take the vaccine or not. On that note, I will say so far the data we have is in favor of the vaccine to save majority.
And how do you go back to restoring for the medical community just trust? Your community I think has probably hit a. And I don't know if there's any polling out there, but again, I don't want to say anything negative per se, but I think because of, I think, I don't know all the ins and outs of this and the pressures that people had to kind of follow a certain kind of quote party line, even though we know that there's recommendations, right? Like I think a lot of scientists and medical doctors get into trouble when they say that, quote, this is the way, or I'm the science, or, those kind of things, right? Like we know over the course of history that things ebb and flow and things change. And how does the medical community go back to restoring trust in the American people?
That's a very important question. And I'm actually going to tell you that the medical community is just as affected as the general public in this pandemic. we've lost so many frontline healthcare workers. It's unbelievable. I hope that history doesn't repeat itself, but we've lost nurses, doctors, techs, not just here in America, but all over the world during this pandemic. And so I think the medical community is on the same boat. Honestly, we all want to be safe. We all want to get out of the pandemic. We all want to save lives. That's our core goal, within the medical community. We all suffered. We continue to suffer. So my personal goal and what I would like to see is keeping it apolitical when it comes to saving public life. And I completely agree with you. We need to be honest, and integrity needs to be there in terms of both the scientific medical community, so that the data that's coming out, it's real and honest, and that, our goals are unified goal to save lives and prevent complications.
Yeah. Do you think in the overall COVID death totals that people who didn't die because of COVID, but with COVID should have been part of because that was a huge controversy and something that happened. I mean, that's come out and is clear, is that if someone died of, and there's a lot of stories about someone who clearly didn't die of COVID, but they had COVID, they were infected with it, but they were counted as a COVID death. Do you think that should have been the case?
No, I think the cause of death should always be clearly stated as what the actual cause of death is. I will say that COVID-19 did cause other complications that led to the death. For example, coming back to the heart, COVID caused cardiac arrest in a lot of people because it caused arrhythmia. In many people, it caused heart failure. And it increased the risk of blood clots, for example, like pulmonary embolism, heart attack. All of those are life-threatening conditions. So anytime we give the cause of death, as physicians, when we have to certify that cause, we always analyze and get to the root cause. So, everybody dies because of cardiac arrest, right? Death means your heart has shut down. But what caused the heart to shut down? That's the cause of death. And so that's the protocol we all follow.
Yeah. Dr. Farah, I'm so glad you took the time to join us today. Thank you so much for being gracious with your time and joining us on Live from Seattle today. Thank you so much.
Thank you for having me. It was a pleasure.